economist. Professor Talita Greyling joins me now from Centurion. Professor, thank you so much for joining me this evening. Looking at your research that you did, you were looking at 3 Southern Hemisphere countries: South Africa, Australia, and New Zealand. And amongst those 3, there were other countries in Europe, of course, but let's focus on South Africa. And we were trending downwards quite, a lot more than the other countries when it comes to vaccine hesitancy.
Yes, we did find it. That actually what we looked at is a positive attitude towards vaccines. And we found that a downward trend over time, which is obviously not what we want.
No, it's not exactly what we want. Let's talk about some of the reasons that, people in South Africa are hesitating to get the vaccine. And one would assume that, the safety and efficacy concerns would actually decrease after so many people have been vaccinated.
What's interesting is when we actually analyzed why people, or their negative sentiment, or why people are not have this positive attitude to the vaccines, it was not about receiving the vaccine as such. So actually the fear of the vaccine, or the trust of the fear of the vaccine decreased. People are trusting the vaccine more. What we found what really influenced the negative attitude is more things like attitudes towards the government. And you could see anger about the rollout. You could see anger about the procurement. There was anger about corruption. That was mainly in South Africa. Obviously, in Europe, the debate was a little bit different. So maybe that is good news, because in effect, it means people are positive about the vaccine, and that the negative attitude that we pick up is because they can't get the vaccine.
That's interesting that maybe we're just combining the general dismay in a lot of ways. I mean, let's put this together in terms of politics and, lack of service delivery. We're all upset about this and about that. So are we people just piling that all together, disregarding their health as well? That's a very interesting, finding.
Well, we were so, what you go into, you've got these ideas, and when you start analyzing what people are saying, it enriches your information and knowledge. I mean, the whole idea for doing this research is to give more information to policy makers so that they can intervene and know what people's concerns are, or why are they not positive. And that's exactly what we did, and trying to find out how can we increase that positive attitude. And that only happens when you really delve into data and try to analyze that. And I think we came up with some solutions. Many people want to get vaccinated, but they've got problems, except for the anger about the rollout process. It's because they can't access it. So something like a mobile vaccination unit or station that can actually go to the people, take the vaccine to the people, and the people don't need to go to the vaccine, can make a difference.
It's interesting because you also looked at European countries as well. We can say first world countries. You got the UK in there as well. What are the big differences in terms of from South Africa and what's happening there? What's trending?
What we found really interesting is that we expected that in Europe, because the rollout is much further, many more people has been vaccinated, we thought that the trend would be different. But it's not. This downward trend we find in all of the countries we analyzed except for Belgium. And Belgium is the exception. Initially, the rollout was a mess, actually, just to put it that way. But then they intervened and found very strong a COVID task team that came in, and they really, there were a lot of campaigns, and they stepped in the rollout process as well, and they turned that around. But the rest of Europe also have this downward trend. The debate is a little bit different to what we find in the Southern Hemisphere. There, the debate is a lot about the freedoms of people, because basically they now have to have a vaccine passport. So you can't go to concerts and you can't go to a restaurant if you have not been vaccinated. And they feel that basically the freedom of choice is affected. So you pick up the anger towards the government, but the reasons between the Southern and Northern Hemisphere, you can pick up a difference in the debate.
That's very interesting. Thank you so much, Professor. So on one side is autonomy and personal freedom in the developed world, we can put it that way. And from our side, it's just access. They just want access to the vaccine itself. Thank you so much, Professor Talita Greyling, Wellbeing economist at the University of Johannesburg.